A federal judge dismissed a lawsuit against the Commonwealth for slashing Medicaid reimbursement rates. Health advocates say the state's new policies will be particularly harmful to hospitals that serve predominantly African-American patients. Our BREE SISON explains what happens next in tonight's Working on Your Bill.
Groups say new Medicaid policies are a step backwards for equal access to health care in our state. This list of 800 diagnosis codes is now the sole determination of how much a doctor gets paid for treating patients they legally aren't allowed to turn away. The list of so-called preventable emergency room visits includes things like diabetic ketoacidosis or an asthma attack. If a Medicaid patient's final diagnosis is on this list, the state will only pay $15 for the ER visit, regardless of how much care the patient actually required. And we're now learning that a federal judge dismissed a lawsuit by 4 healthcare trade groups, saying even though the policy will be harmful to Virginia providers, the issue must be taken up by the General Assembly.
In a moment where we're having a lot of important conversations as a society about things like equity, access to care, disparities in healthcare outcomes for people of different ethnicities. We've done an analysis on what these policies would mean, and these policies would disproportionately impact patients served by hospitals that serve predominantly African-American communities in particular.
Those healthcare groups tell the problem solvers they will pursue every avenue possible to try to get this Medicaid policy reversed. Working for you, BREE SISON, CBS 6 News.